what about your use of NGS in these patients? So I think this is the one disease that at least I treat where NGS does not play a major role. So next generation sequencing is what I'm getting at. I'm not treating you properly until I know exactly what your molecular profiling is showing. But in HCC, for a variety of reasons, one is because we really don't have a lot of biomarker-specific targeted therapies, and the other is that we often don't have tissue. What's your use of that?
So for HCC, it's relatively low. If you were to compare it to the other GI cancers that we care for, it's relatively low. Again, some of it is a starting point because quite often the patients don't have a biopsy. I've been thinking about that more, whether I should biopsy the patients, not for diagnostic purposes, but just to have something cooked and banked so that I can consider things down the road. Now, I'm not in the few patients with HCC that we actually have checked. I didn't find anything. What is the value of doing it? Nowadays, there are some of those circulating ones where you don't need to have a biopsy to come up with what the molecular changes that are going on within the tumor. You don't necessarily need to have that information. And so I have used those a few times. Have I found anything? No. But still, we don't necessarily have to do the biopsy to try to get some of that information. And on top of that, the clinical trials will accept blood-based assays for enrollment most of the time. But I'm still looking for my first HCC patient that has something that I can actually use, a therapy that's outside of the box as far as what's already approved.